all the listeners on this live chat. I am Brigadier Rajesh Madan from Clove Dental. I welcome you to this live session, How to Take Care of COVID Patients. It is a very vital subject, and what we feel that everybody of us should be aware of this. First phase, we had a fear, it has gone. Then suddenly the second phase has come, and this second phase was very deadly because we were not prepared at all. And we have also not followed the COVID behavior which was introduced in first phase. So, most of the family members or their near and dear or their friends, they all were down with COVID. Even I was also down with COVID. But to whom I should ask, how are you? Then the answer was, I am down with the COVID. So somehow with God's grace, many people, they have saved their life, but very unfortunate people, they have lost their life also. Now, second phase is slightly going down, but now there is a fear of third wave. Now the doctors and the medical fraternity and the scientists, they have announced that the virus is having a lot of mutation, and Delta plus virus is already in presence in many countries and even in many states of India also. So our now aim is how to protect ourselves from COVID 3 wave. It is very important. It will be there. And how to save ourselves? We have to protect ourselves. We have to follow COVID behavior and to protect our near and dear. So my topic is that how to take their care at home. If they fall sick, then what is our duty? It is our duty. We can't discard our own people that you are having COVID. Like in phase 1 happened, it was in the news that the people discarded the people that you have COVID. I will not touch you. I will not come near to you. So this attitude should not be there. We should know how to protect, and if we do wisely the protection and the COVID behavior following, then this phase 3 will also bypass. So for this, what we have to do now, we should be mentally prepared that anybody can get in our family or in our friends or in our near and dear circle down with the COVID. What they should do? They should be mentally prepared. They should isolate 1 or 2 rooms, whatever is the availability at the home, that if something unfortunate happens and if the third wave COVID attacks our people, then we should have our room ready at home. So now what all should be in the room? We should have oximeter, we should have blood pressure machine, we should have thermometer. So these things should be ready at home, and that room should be very neat and clean. It should be airy. That how we can make it sure that it should be neat and clean. So like disinfectant slicers, we can use it, and the surface disinfectant we can use it. So we should be mentally prepared and keep it ready at home. So because it is very unpredictable how it catches a person. Even in second phase also, it was not known from where it has jumped to the other person. So but they say that the third COVID variant, the Delta plus, is deadly, and their symptoms comes within 3 to 4 days. So what we should do? the person who is looking after the diseased or who is having the COVID should protect themselves. They should use PPE. They should not discard the family member. That is the main important thing. If you are not prepared, then the things can go wrong. But if you are prepared, then you can win the battle. It is a battle. And how you can win? If you are prepared. And if you are prepared, nothing will happen. And most of the people, they recover. And in this, I would like to mention something about vaccination also. If vaccination is there, then to some extent that they say that Covishield 67%, Covaxin some more, the others which are in the foreign, they have like that. So at least some protection is there. So one should get vaccinated as well. One should not be shy away that with the vaccine fever will develop, this thing will develop. So if fever comes, or if you have lethargy, if you feel drowsiness, then it is the sign that virus is there and your immunity is going to be improved. So it is the myth that vaccine may cause some dangerous thing. It is not there. So how to look after patients at home, that I will discuss you. First I told you to isolate the room. Then you see the morning till evening session. What you do, the same thing the patient will be also doing it. So first of all, the bathroom and toilet should be neat and clean. And the brushing, if it is a common toilet, then cleanliness is more important. And if it is separate, then yes, of course, that time also that hygiene and cleanliness is required. But what we should do, if the patient is using the brush or the tongue cleaner or the interproximal brush, they should discard it regularly, because these hygiene aids may harbor the bacteria and virus that may virulency of these microorganisms will be again coming into the body. That will be dangerous, because your immunity is down and your body is not able to fight. Just a minute. Thank you. So your body should be able to fight this thing. For that, you have to discard your brush, your tongue cleaner, your interproximal brushes, your floss, and to some extent your toothpaste. Other person at home should not use it, because it may transmit the infection from the toothpaste as well, because till today we don't know from where the infection travels. Even when I was down with the COVID, many people asked from where you got it, from where you got it. There was no answer, because I didn't know to whom should I pinpoint that from this person or from here or from there. So be careful, protect yourself. Protection is the only answer, and don't be scared of COVID and Delta plus virus, because once it is there, you have to live with it. But how to live with it, it is up to you. You should know. And if you get trained yourself how to look after the sick person, it will be very good, for anybody at home. So what time food has to be given to the patient? Healthy food should be given to the patient. It should have more protein, so that immunity should be built in the body. And along with it, one can have vitamin C supplement and vitamin D supplement. It also boosts the immunity of the person. So now you have seen the diet portion of the patient. And after giving the diet, dispose of his utensils. Because the utensils, if it is disposable, then it is better. Or if it is not disposable, then wash it with the soap and keep it separate for that patient. One should not use that utensils time and again for other person. So now your utensils are different. Your diet is, I have told you, now you are already equipped with the oximeter and your BP machine and your thermometer. So keep the record of all the parameters and see whether there is a progression or it is declining. If progression is there, it means the patient is recovering. If it is declining, your vital parameters are declining, then have a guide of some specialist doctor, because specialist doctor can guide you what to do and what is the next. But if you have patient at home, then first thing comes that you have to look after that patient. Now you have done three things. First is the isolation of the patient, second is the cleanliness of the toilet, third is your dietary product, and fourth is your dietary product, and fourth is vital parameter recording. So this vital parameter recording is very, very important, because your medicines regime depends upon your these parameters, and whatever tests are there, that can be done what as per the doctor's advice. So these medicines are regulated by the doctors if you will feed the correct parameters of vitals to them. Now comes that how to look after these patients. As I told you, uh, look after, don't get shy. If you are looking after, protect yourself, because as I told you that it is going to be there, because most of the scientists and most of the countries, they have accepted that it is not going to so soon. So we have to live with it, but we should know how to protect ourselves. Like if patient is having in dental care, I will tell, if patient is having some discharge or some swelling or some red or white patches on the tongue or on the cheeks, it starts from the tongue mainly. Tongue is more vulnerable as per the like study. So tongue get bilaterally. Bilaterally means both the sides. So ulcers will be on both the sides, swelling will be on both the sides. And first comes the tongue, second comes the cheek, third comes the palate. These changes take place in the oral cavity. It shows that the immunity of the person is low. And how to improve the that immunity of the person? One should use the mouth washes, and these mouth washes are chlorhexidine or betadine gargle. If they will do that, the virulence of virus will be checked. And proper brushing, how to hold the brush and do the segment wise. First the lower you do, don't do the haphazard brushing. Haphazard brushing will not clean all of the teeth. So do segment wise. Once you are sure that you have cleaned the mouth, then you discard your brush, not daily, but say after a week, discard the brush, use the tongue cleaner and the floss, or the, so that why I'm telling you this thing. This is already in study, that if the load of the virus is less in the mouth, then automatically it is less in the body also. Then more complications will be checked. There won't be more complication in the body. So as we know that virus travel from the mouth only, then it rests in the lungs, then it goes to the other vital organs, and coagulation of the blood. So it is a deadly and multifactorial virus, but we have to check it. So patient asks me why I am having this COVID. There is an underlying, that if somebody is having systematic disease like diabetes, or like if patient is having cancer, where patient is taking corticosteroids, that is a steroid in the layman language, corticosteroid, then the body resistance goes down, immunity goes down, and then when the body immunity is down, virus get the space to multiply. So here you have to check this virus, that patient should take the proper medication for their other systematic diseases also under the supervision of specialist doctors from where they were already taking this treatment. Now the other question comes, what we should do so that our virulence in the mouth should be less. The mouth should always be hydrated. Hydrated means one should take optimum water. If somebody is taking optimum water, then in the dryness also the virus cannot survive. Not dryness, in the like hydration. Yes, in hydration the virus cannot survive. I can't say survive, but it cannot multiply, if you ask me correctly. So these things are very important for the persons now. If they are alright, if they are not having COVID, and somebody at home is having this problem, then one should protect themselves before attending the patient. That is the formula. We can fight this virus very easily if we follow all the COVID behavior. And the second phase, why it was so dangerous, because we were become relaxed. We didn't give any importance to the first phase, and we thought it has gone. So, but virus got the opportunity, came back, attacked the people, and many people had a fatal unfortunate fatal this thing. Some people said that oxygen is not available. Some people said that mucormycosis is there. Yes, mucormycosis can take place. It is a fungal infection, but it is due to many reasons. This virus, this fungus is always in the environment, but when the body resistance is low, it attacks, multiplies, and mucormycosis. That's why I'm giving importance to the mouth checkup. If somebody is alright, never forget to go to a dentist, and to go to that dentist who is following the COVID behavior. If that doctor is not following the COVID behavior protocol, as in Clove, we follow 10x safety, and we are very much confident. I am 67. I have been told that the elderly people, they get they are exposed, but I am not scared of, because these places are very much protected, and these places where we are working, all precautions being taken, so neither our doctors can give nor any patient can give, because we do the triage, we do everything. And if you have any doubt, one can have appointment, one can go get the checkup done. And why the checkup is important, we don't want that the thing should multiply where we cannot control it, but the early treatment is always better if somebody comes and get their checkup done. And if somebody is ambulatory, then can go and get the deep scaling done. With the deep scaling, the virus accumulation is not there in the mouth. Its density goes down, and then further it cannot, that dangerous effect cannot be there. So there is a very important role of oral checkup, oral aids. Oral aids means like mouth washes, proper brushing, and tongue cleaning, and checkup, because even I don't know what is happening in my mouth. I am dependent upon, although I am a dentist for many years, but still I can't see inside the mouth what is happening. I am dependent. So if I am dependent being a dentist, then the person who is not dentist, he should go and get the checkup done. And this checkup will tell you what's going to be, like what we should do and how to protect. And in Clove, I can assure you 100% we are taking all the precaution and we are following the COVID behavior, and we insist to you and our patient to follow the COVID behavior. And with this, I'll just answer the question which have already in the scroll. So I will start. Everybody has appreciated that nice presentation, but where are the questions? You should ask question also. Any question? One Meenu Arora asks, oral cavity health is important for patient and the caretaker. Thanks for explaining. Achha, she is giving me thanks. That's fine. See more. Now there is no question, but I will ask you the question. Do you visit your dentist or not? If yes, regularly, every 6 months. Our regime is, we tell to the patient that always visit a dentist so that we can give you the timely and less complicated treatment. Otherwise, if you won't visit, then the treatment gets expensive and more complicated. So the same tooth can be filled also. The same tooth can be, like root canal can be done on the same tooth. Same tooth can be extracted, and the same tooth, give you many phases. So try to come to the dentist for checkup so that you can save unnecessarily expensive and time consuming treatment. Very helpful information and more. Let me go through the scroll. Good thing that everybody has appreciated that it is very nice, and I must come more often if everybody is liking it. So my closing remark is thanks to everyone, and you all appreciated. I'm very happy, and moreover, patient care is very important. Anybody can become a patient, because in the second phase there was a myth that मेरे को तो COVID नहीं हो सकता. Same thing happened with me also. When people, I was having fever and cough and cold, and I was advised to go for that test and all that. I was telling मेरे को तो लग रहा है कि ये viral fever ही है, ये नहीं है. But when the test was done, on the insistence of my family members, it came COVID positive. So don't take it lightly. Be careful. Protect yourself. Get vaccinated. In our Clove, our whole staff is vaccinated, and they do all precautions and we make it sure that the virus should not win. So we can stop at the gate. So confidently, one can visit at least Clove Dental, which I can vouch for it. Thank you so much, and I am grateful the people who all have attended, and it is nice conversation with you, one-sided although, but I hope you must have carrying some good and will be more how to protect our own people at home. If you want to see some books, how to, or you want to contact me, you are free to contact through our DSC line. I will guide you much more wherever you have queries. So our DSC is open 24 hours into 7. So you are most welcome, and I hope I could tell you something for which I wanted, and my company, this Clove, wanted that most of the people, if they are not aware, it is our duty to make them aware that Delta plus virus is coming. So we should all be ready to control the phase 3. Thank you so much. Good luck.